This is Kaylie Plemens from Roane State Community College with Stan Grubb, Lifeline Regional Coordinator at the Roane County Anti-Drug Coalition. Epidemic pain pills, substance abuse, all of this seems to be problems throughout Roane County. Tell me about what your job is.
Well, it's definitely a problem in Roane County as well as the region, East Tennessee region as a whole. My role basically, I work under a state grant, and that role is to basically do anything I can to help facilitate recovery efforts in the 16 county region. And recovery basically means if somebody has already made the choice to become addicted, and that's usually what happens. Sometimes people might have a surgery or something and they don't realize they're getting addicted to maybe a pain pill, and they find themselves, actually trying to go out and find the pills on the street. And that's a serious addiction issue. And my job is to try to help them find ways to come out of that dependency. And that might mean helping them find treatment centers. It might mean helping them find recovery meetings. It might mean establishing more recovery meetings than what's already available. So I try to do anything I can to help, as I call it, help them pull them out of the pit, so to speak.
And they most definitely need that guidance and training and anything to bring them out of this horrible rut.
And it's not always easy, and it's not always quick, and sometimes it takes multiple attempts to actually come out of that issue. Alcoholism was one of my issues, and I tried several times to overcome that, and I would make a little progress and fall back, make a little progress and fall back, and eventually, though, some right combinations came together in the right time, and eventually I felt like I got over that hump, and that's really what we're as far as my role is, to try to help people make it to that far.
With not only drug abuse, but alcohol abuse as well.
Exactly. And, an interesting statistic recently was that for the first time, our commissioner, Varney, over the State Department of Mental Health and Substance Abuse Services, said that pain pills had actually surpassed alcohol as the number one cause or the number one substance abuse issue in the state.
And this is becoming a huge problem in Roane County, not only just Roane County, but all around. Seems to be like all of East Tennessee, even into Tennessee as a whole. East Tennessee has a definite epidemic,
so much so that the governor actually rolled out what he called the Prescription for Success, Governor Haslam, and it's actually a plan to try to attack and combat the pain pill epidemic. And it's pretty thick, and there's a lot of strategies. And one of the things that the Roane County Anti-Drug Coalition is doing on that is actually educating and trying to prevent people from actually going down that path in the first place. And so the prevention angle is definitely a must-have, because if we can prevent that issue from ever occurring in the first place, then we can save the taxpayers money down the road.
And the prevention is out there, so they need to, emphasize to young students as well as in high school and college, anyone that's about to go down that path, or even thinking about it.
And education is a huge part of that, and it's simply, sometimes it's simply helping people realize that when they have an operation or an injury, that these substances can be potentially addictive. And then if they can actually work with their physician on, weaning off of that if it's necessary. So a lot of that's through education and prevention, so yeah.
And today, overdose is the #1 leading cause of accidental death under all of Roane County, Tennessee, and even the nation. So can you emphasize on that?
It's sad but true that overdoses are capturing headlines as the #1 cause of accidental death, like you said, and it's not only in the state but in the nation as well. And I see that headline come across the newspaper I pick up every once in a while, and it's really just a measuring stick of how bad the problem is. But The flip side of that coin is it is an issue, a major issue, but we are trying to do and implement ways to actually combat that through prevention, Roane County Anti-Drug Coalition, and helping people get into recovery as well. And I really fully expect over this next couple of years, and I don't know how long it'll take for the numbers to come in, but I think those numbers will start dropping significantly.
I believe so too, because the help is out there. People just need to listen and make sure that they do not go down that road.
Exactly.
And this is even over car accidents.
Yeah, you would think that that would be the leading cause of accidental death, or things, heart attacks or whatever. But it's sad but true that that's leading, a leading cause of death. So accidental death. Accidental.
And there were 18 deaths in overdoses throughout Roane County.
Throughout Roane County last year, 18 accidental deaths, and due to overdose. And another thing that's actually come into the picture in the last year or so is naloxone, which is a drug that can be administered to people who might be prone to overdosing. And so those are the kinds of things that are starting to come onto the scene that in order to combat that issue.
And neonatal abstinence syndrome, also known as NAS, is
Right.
a huge problem as well.
Major problem in the region. Basically that is a term that's used to describe babies that are born drug dependent if the mother is addicted to opiates. And it's sad, but we're leading the nation in that category and the region. I think in Roane County last year there were 11 that were born that were classified as NAS, neonatal abstinence syndrome. The huge thing there again is prevention and getting folks into treatment or recovery in order to help curtail that epidemic and that statistic, because we really don't know long term what kind of issues those kids are going to face because they had that type of dependency in their early years when the brain was just developing and things were starting, motor skills and things were starting to work together. So prevention again and recovery is the key to addressing those issues.
Just to help the mothers not get into the situation for the help of the baby.
Right.
And RCADC has a prevention benefit cost analysis, and that is for every $1 spent, you save $14.66 in public burden spending, also known as tax dollars. Can you speak on that?
It's amazing how when you look at that study, how important it is to realize that if we would put more of our time, effort, and our resources into prevention methods, then what we could do is actually save money in the long run. I used to work for a company that sold different types of what we call preventative maintenance, devices, and if we look at it as preventative maintenance, that's really what this is. When you look at prevention efforts and education efforts and even recovery efforts, it's actually going to save the taxpayers money down the line if we will put more money into education and prevention and recovery. And then we can build better schools. We can have, the highest, latest technical, high-tech equipment in our schools. We could have better hospitals, better courthouses, better law enforcement. We could afford that. But if we're always trying to pick up the tab on overcrowded jails and things like that, and really that's where a lot of these issues are coming from, is our addiction issues, basically. And that's one reason why prevention and recovery is so important, is because we can actually stem the tide, so to speak, from going down that direction.
And these are all benefits to help our community with the better schools, the technology,
Right.
anything like that. So just with every $1 spent, it's going to help a lot.
Absolutely.
Well, thank you, Stan, so much for helping our community as well and being with me today.
My pleasure.
And thank you all. See you next time.